So David, you're across in-city issues in Australia and you're one of the leaders in this sort of domain, particularly around innovative uses of phone counselling. Can you tell us about some of the big ideas that you see on the horizon for this issue?
Yeah, well firstly, I see Australia no different to other parts of the world where rising rates of chronic disease and lifestyle disease are really having a huge burden on our healthcare system. In fact, I heard a stat the other day which was quite alarming. One Australian over the age of 25 is diagnosed with type 2 diabetes every 5 minutes. So from the time we've been sitting in this room, the entire 2 rows in the front have been diagnosed with diabetes. Secondly, the ability for our health systems to cope with this influx of demand. Our current healthcare systems are really provider-centric rather than truly patient-centric and focused more on acute care and hospitalisation rather than more self-management and true patient-centred care. And thirdly, I think funding is currently geared around sickness rather than prevention. So there's some of the challenges. I think when it comes to some of the solutions, we need to change the national dialogue. We need to bring healthcare into the homes of people. We need to make it real for them. We need to empower people to really embrace their health and give them the tools and techniques to help them self-manage their condition.
And what's Remedy doing in this space? So you're here obviously representing an organisation. Can you tell us a little bit about what you guys are doing? Because it's quite innovative. I mean, we obviously we needed a partner in this, but we were very particular about partnering with someone that we felt had the same vision. And we talked about this beforehand. Yep. So what is Remedy doing about this?
So Remedy is a unique organisation, I think, and what we do is that we provide personal health coaches to people, similar to like a life coach, but better. This person can work with people to really understand their health and get to know what are the barriers that are getting in the way to achieving great health outcomes. So what we do, we provide personal health coaching. We actually do that along with social media. We've got a strong social media presence linked with our health coach, but also use technology such as health apps, as well as in-home care where it's required. We strongly feel that if we can change the healthcare setting to be more in people's homes, we can change the health economics, which in turn will move the dialogue to prevention rather than illness. Okay. Essentially what we're trying to do is change people's behaviour. That's the key thing.
Yeah, which is what I was about to ask you. So obviously getting people to change their behaviour, we've converted everyone in the room and they're all going to totally change their lifestyles from tomorrow, but it's not usually...
Especially the red dot.
Yeah, especially the guy with the red dot. He won't be a red dot next time. But it's not usually that easy. Have you found it to be a difficult process?
It's incredibly difficult. A recent report released by Baker IDI here in Melbourne showed that 2/3 of people who've had a heart attack fail to change their behaviour. Think about that. It's 2/3 of people have had a heart attack and yet they still make poor health decisions. And why is that? I think it's because people are generally sick of hearing all the things they need to do to change their life. I mean, who here likes being told what to do? Raise hands. Nobody. Not one person in the room likes to be told what to do. Imagine if a healthcare professional is telling you what to do constantly. People disengage with that. So the trick is actually tailoring the health intervention to the way people want to be communicated to and finding the motivators that's going to help them make changes. Looking at those intrinsic things that are going to change people's behaviour. Once you've done that and built rapport, you can then remove those barriers and help people set goals themselves to manage their condition. That's what we think works best in this context.
And what are you finding? Is it working?
Yeah, it is actually. 95% of people who go through the Remedy programs actually complete that, which I think is quite extraordinary actually, because how many people have bought a gym membership only to find that 3 months later they've never used it? All good intentions, but people need that motivation. So to have that many people finish our program, we're quite proud of that fact. The challenge is getting these types of programs funded and getting them more broadly accepted both in Australia and around the world.
Yeah, so we obviously just heard from Byumba. I mean, is there an application for this, do you think, in other countries globally? Absolutely, there is.
I think we have to be a bit careful though. I mean, as you would know probably better than most of us, transporting one healthcare system or program from one setting to another as is just won't work. You need to make it real for people in that context, that culture of that company or that country. But it is possible to do so.
And any final thoughts for us before we leave tonight, David?
Firstly, what a wonderful group of speakers you've had here tonight. I've really enjoyed it, and thank you for letting Remedy Healthcare be a part of the night. I think what I would like to say is it's important not to be alarmist about NCDs. But let's not solve the problem after the fact. Let's act now. And also, let's not be scared to disrupt our thinking, because otherwise we'll end up being disrupted ourselves. So thank you very much.
Thank you very much.